Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Today I want to talk about keeping up your pharmacy skills. So if you think back to our earlier episodes when we were defining pharmacy informatics and what it takes to be a good pharmacy informaticist, one of the things I mentioned is you have to first be a good pharmacist. You have to understand pharmacy workflow. You have to understand what the pharmacist does in the pharmacy when they're reviewing orders, dispensing medications, everything along the med use process. And you need to know that because you can't automate the med use process unless you know the med use process, practice it, and do it. So I'm going to say to you, if you want to be a pharmacy informaticist, great, go ahead and specialize. But remember, we went to pharmacy school to learn pharmacy, all of pharmacy. And as pharmacists, we need to keep up our skills even when we specialize in a different area of practice or a special area of practice. So when I was in pharmacy school, all 4 years of pharmacy school, I worked as an intern in a community pharmacy. And when I graduated, I started working as a hospital pharmacist and continued to do per diem work at a number of community pharmacies. When I left my hospital job 6 years after graduation to do my residency, during my residency, I was also moonlighting as a pharmacist at a local hospital to, again, keep up my pharmacy skills. And I continued to do that throughout my pharmacy informatics career. I always, at every institution, was determined to do some per diem work to continue to work as a pharmacist so I could really understand practice, current practice. Another thing that I'll mention, I've been doing a journal club series. So to help me keep up with pharmacy practice and what's going on out there, there are 2 publications that I read regularly. One of them, you probably guessed, is AJHP, the American Journal of Health System Pharmacists. And this is good for me since I've always been focusing on acute care, but you know, it does touch on ambulatory care. So good way to keep up on what's going on in health system practice. The other publication that I read that's been invaluable is the Pharmacist Letter. And this is something that is very useful because it's quick and easy. Every month you get 6 pages of some very distilled articles, some topics that are very current, what's happening out there in the world of pharmacy, both inpatient and outpatient. And the good thing about those little articles is you can get an idea of what's going on, and then if you want to dig further, you can go in and log into the website and do your research. They will give all of the references that they use to create those review articles. And in addition, you can find a lot of other useful tools like wall charts, other information that's related to that specific topic. You can go and look at the references and go back and read the original articles so that you can make your own opinion about what's going on with that current topic. Remember, as pharmacists, we need to keep up on what's going on out there. Our practice has to be evidence-based, and we want to follow therapeutic guidelines. We want to know what's happening with immunization recommendations. So we need to keep up on all of this, and Pharmacist Letter is a good way to do that. Now, of course, with HHP and Pharmacist Letter, you can read these electronically. I'm old school and I like to have them in print, but I do go to the websites to do further research. So as I continue the Journal Club series, I will be talking a lot about articles out of AJHP, but I also will cover articles from other journals too that are related, and especially ones that focus on pharmacy informatics. And I will, in a future episode, actually talk about a news update that was in the latest Pharmacist Letter for December 2020. and it talked about digital health. So I'll talk about digital health, talk about the Pharmacist Letter article, and then maybe talk about a couple of other journal articles too that were related to that topic. So just to summarize, if you want to be a good pharmacy informaticist, make sure that you are a good pharmacist, that you know pharmacy practice, and you know where we can apply information technology and automation to the medication use process to help us become more effective in what we do and to provide safer, evidence-based therapies. If this video was useful for you, please like it and subscribe to my channel, and I'll thank you for that. In the meantime, stay safe, stay healthy, look after the health of others, and I'll work on those future episodes, and I hope to see you next time. Take care.